Can you see the screen? Thank you, Diamond. All right, let's get going. GIs and GUs. Again, try to keep track and not get them confused. All of the following are symptoms of dehydration in an infant. So dehydration, any patient, right? You're gonna have that dry, pale skin. You're gonna have the tenting, loss of elasticity, decreased urinary output, decreased urinary capillary refill, elevated heart rate, decreased blood pressure. I could go on and on. The color's pale, fontanelles. So there's so many things that we can look at. What is priority treatment for a child with dehydration due to profuse vomiting? What are you going to do for a child who's vomiting? So when you're vomiting, number one, make them NPO. Of course, you'll give an antiemetic, but it's IV fluids as your treatment. IV fluids are for vomiting. We would do oral electrolytes for only diarrhea. We still need to get fluids. What is the treatment for an infant with diarrhea lasting for 4 days? One of the things about children is how do they look? Are they well appearing or sick appearing? Some kids, 4 days diarrhea, it's not a big deal. Other kids, they look pale and look horrible, right? So, but diarrhea, what should be the treatment? Pedialyte for that infant. If it lasts longer than that, or if they look horrible, or their heart rate is 200, yes, we would go for IV fluids. What acid base imbalance may you see with a child that's having profuse diarrhea? On the last several HESIs, there's 3 and 4 acid base questions. So I'm going to hit you with all of them. So when you're losing diarrhea, you're losing alkaline. All of those digestive enzymes are alkaline. So what is left? Acid. If you're throwing up, you're throwing up stomach acid. What is left? Alkaline. So you're left with metabolic alkalosis. Okay, that's how you got to remember this. And, respiratory alkalosis is when you hyperventilate. Okay, they are there, they're on it. I've seen them almost every single essay. If an infant has not passed the meconium stool within the first 24 to 36 hours, what would you assess for? So no stool hypothyroidism, cystic fibrosis, and Hirschsprung's disease. Does electrolyte imbalance really part of constipation? No, not really. Deficiency of vitamin D could cause. Isn't this why we give vitamin D to breastfed infants? Because we're worried about bone health, right? It's the rickets. A multi. What treatment can the nurse anticipate to a child unable to drink or eat anything with profuse vomiting and diarrhea? Unable to drink or eat anything with profuse vomiting diarrhea. So this is one of those combination things. What do you do? Well, they're unable to drink and they're profuse vomiting. So we need to do just IV fluids and your metabolic profile. Nothing orally. It's just going to make them vomit more. A multi. What nursing management would you anticipate for a child with a ruptured appendix post-operatively? Remember I told you about ruptured appendix, peritonitis. What does that belly feel like? What do you need to do? So you wouldn't put on complete bed rest anybody with abdominal surgery. You want them up out of bed, coughing, deep breathing, okay? Child, adult, don't matter, up and out of bed. NG tube suction, keep that good old abdomen cavity without anything that bothers it, including just the saliva that you're swallowing. IV antibiotics, you have an infection that's raging on. And remember, once we close up that incision for a appendix that has burst, those edges are dirty, we call it, because the inside was dirty because of all of that peritoneal fluid that's got the appendix stuff in it. So again, a lot of times these will dehiss. I've actually seen appendix dehiss because of appendix of peritonitis. Passage of urine, usually at night in children who should have voluntary bladder control, is called epispadias. The hole is down there on the top. Hypospadias is on the bottom. Vesical urethral reflux between the bladder and the ureters. And uresis, that is when we urinate at night. Yes. A multi. What is Hirschsprung's disease? Hirschsprung's disease when there's no nerves in that portion of the intestinal tract. It's also called a congenital aganglionic megacolon. That means you're born with it, aganglionic, no nerves, and it's an obstruction, megacolon. A multi. When teaching parents about Hirschsprung's disease, the nurse would include what? So Hirschsprung's disease is a bowel obstruction. Furthermore, because of that, you taking that piece of intestines out, you should be aware of the bowel habits as we go forward. Hopefully, we're going to do one surgery pull through, but if not, it'll be a two-stage surgery. And we do not do anything laxatives, enemas with children. We don't believe in them. We do other things, even diet, increasing fluids. What type of stools would an infant with Hirschsprung's disease have? Remember, there's that little tip that's down there on the bottom, and it's what we called ribbon-shaped stools as part of it, okay? Which is a condition that occurs mainly in children when the intestines telescope into each other. And that is called intussusception. So I noticed some people weren't on camera. Could you please come on camera for me, Brianne and Nelson? A multi. A 2-month-old infant has GERD and has been treated by thickening the formula. How do you know that it's working? Well, what's working? What is GERD? What does formula thickening do? Well, we use GERD because we don't want the spit up to be as much, okay? We want to decrease that as much as possible. So less regurgitation. Also, is there a weight gain? If they're having this reflux, we're worried about nutrition. They're gaining weight. We know they're keeping it in. They're gaining weight. It's what we want. How can you decrease the incidence of enterobiasis in children? Enterobiasis, these are your worms, whether they're pinworms, roundworms. How do kids get them? The big things is just to keep their fingernails cut short. Because remember, what do kids do all the time? Everything in the mouth. So they're always, so keep them short. It's another reason why. What are signs and symptoms of enterobiasis, pinworms? How do you know your child or that child has pinworms? I call them wiggle butts because it is intense, intense rectal itching. Remember, it's a flashlight, it's a piece of scotch tape, and get a piece so that we can show it to the doctor and get the proper medication to get rid of it. GERD, gastroesophageal reflux disease, is what? So reflux is it what goes from the stomach and it goes back up into the esophagus. Our biggest concern is aspirations, many aspirations. So remember, your older kid's going to cough, and that's telling you, "Ooh, I'm having many aspirations." What would the nurse be looking for when a patient has Meckel diverticulum? Remember, that's the small intestines, a little piece of a diverticuli or little piece of tissue that comes out. And inside that tissue is this big blood vessel and it rips. And it's called painless rectal bleeding. They usually have to do this the radiography where they put a dye and they find it in the small intestines. And then they have to go in and just clamp it off, is basically what they do. A 6-year-old child goes to the ER with abdominal pain, fever, and vomiting the last day. What assessments is priority? Well, like, what do you need to know about? Well, they have abdominal pain, they have fever and vomiting for the last day. What do you need to understand? Whenever I have a child coming in and asking me or telling me their tummy hurts, I want to know with one finger, show me where, right? If it's right on the belly button or it's right above the xiphoid process, that area, we know that's stomach something, but it's that description, right? Lower quadrant. All right, now we're talking. This is an appendix. We need to get this child ultrasound and up to surgery before it ruptures. What would the nurse expect to see in an infant with biliary atresia? Remember, biliary atresia, there's no connection between the liver and the small intestines. So you're not digesting fat. Not digesting fat, we're going to see, of course, the clog up with the bile. You're going to see this child is turning jaundice, the skin and the eyes, but there's no color now in the stool. So it's clay colored stools. And not digesting fat, you're going to see gas. And this is abdominal distension. That's how you see it. What structure of the mouth can be impacted by cleft lip and palate? It's a little bit of everything, isn't it? And it does make a difference to get them done and fixed quickly for the speech part. Cleft lip repair is typically done when the lip. Usually about 2 to 3 months we do the lip. Remember, we want the whole repair done before 12 months because they usually typically say one word by 12 months. So we want that pronunciation to start out correctly. When does cleft palate repair typically occur? Well, we know the lip is 2 to 3 months. The palate is somewhere between 6 to 12 months, before 12 months, usually. Esophageal atresia. Remember, A is a without. I guess I like the question. We did it twice, right? And there's no opening from the stomach to the esophagus. What are the classic signs of esophageal atresia and tracheoesophageal fistula? Kid is born, and we have no clue that this child has anything wrong with it. What would that infant look like? And right here, you have the diagnosis to all the big ones. So which one do you choose, right? So esophageal atresia, tracheoesophageal fistula, there's no connection to the stomach. So we've got fluid coming up. Tracheoesophageal fistula, I've got my mucus or whatever going across my esophagus into the trachea and my lungs. And I'm coughing, I'm gagging, I'm choking, and I'm turning blue. That's what the answer is. Now, olive-shaped mass, right upper quadrant, pyloric stenosis. Bilious, eminence, and frequent stools, that could be biliary atresia. Current jelly stools, failure to thrive, abdominal pain, intussusception. A multi. Neonate with suspected tracheoesophageal fistula. Nursing care should include. What's your biggest concern about preoperative care on this child? You've been diagnosed. They have a tracheoesophageal fistula. How am I going to take care of them? What's my concerns? So I want the head of the bed elevated and nothing by mouth. We are not going to feed this child, so we're not going to elevate the head for feeding. And the big one with this one, tracheoesophageal fistula, you are having many aspirations. You need antibiotics. IV fluids, antibiotics, NPO keep the head of the bed elevated. Remember, pyloric stenosis, IV fluids, NPO, but there's nothing that's going to come up, so they're not vomiting. You don't need antibiotics. Those two are always mixed up, always. A 5-year-old child's complaining of epigastric pain and a persistent cough. What do you think that is? Epigastric pain and a cough, and what is it? This is probably reflux. Remember that epigastric pain, that cough, could be mini aspirations that's showing that. What is ranitidine used for in a child with peptic ulcer disease? They change the name of this one all the time. It used to be cimetidine. They don't use that one anymore. Ranitidine, they've taken that one off the market. Now they're using famotidine, which is your Pepcid. And all of this does, it decreases the amount of acid in there. So not acid, the stomach line's not getting eaten up by all this extra acid, and it gives it a chance to heal. Signs and symptom of a hypertrophic pyloric stenosis. So pyloric stenosis is that thickening in the pyloric valve and doesn't let milk go down into the intestines. And you can feel it by that olive-sized mass. And remember, pyloric stenosis is projectile across the room vomiting, like impressive across the room. Signs and symptoms of hypertrophic pyloric stenosis. Projectile vomiting and poor appetite. No, they're hungry, aren't they? Because they're vomiting and they're still hungry. So they want to eat more, but then they eat and they vomit because it won't go down. And it won't go down, so I'm hungry, so I eat more. And it's like that. So it's projectile vomiting. Preoperative treatment of pyloric stenosis includes. So pyloric stenosis, NPO, IV fluids. This child does not need the antibiotics. That's only tracheoesophageal fistula, and when they don't have their esophagus. Both of them do need it because of the chances of vomiting and aspirating. This one doesn't vomit once their stomach's empty. What does the celiac disease affect? What's the celiac disease all about? It's all about small intestines because remember, small intestines is where nutrition and all the enzymes are made, right? Where it's delivered to, where it breaks it down. Celiac disease is a nutritional problem, has to be the small intestines. If you have celiac disease, what should you eliminate from your diet? Wheat, rye, barley, and oats, and the good one to replace it with is rice. You can have dairy, you can have ice cream, you can have chocolate, fruits, vegetables. Yes, nothing with wheat, rye, barley, and oats. So no macaroni and cheese and no spaghetti and no garlic toast. Mm-mm. Priority nursing care of a child with a ruptured appendix postoperatively. So, post-operatively, the big priority is antibiotics. Yes, the child's going to be in pain, but no antibiotics. You have a ruptured appendix, it's your priority. I understand you want to keep them comfortable, but number one, antibiotics. Number two, pain medicine to get them up, get them out of bed, etc. A multi. How can you assess the effectiveness of fluid replacement for a child with severe dehydration? I think all of that stuff you can sort of figure it out. It all relates to it. But our biggest one, yes, is the weight that we can see it. Heart rate comes down, capillary refill is improved, blood pressure is more normal. All of those things. Increased urinary output, color looks better, fontanelle looks better. A multi. Vitamins that children with celiac disease are prone to lose are, well, celiac disease is a problem digesting fat, just like cystic fibrosis, problem digesting fat. Which of those are fat vitamins? Everything but vitamin C. Vitamin C is a water soluble one, okay? What foods would you select for a child with celiac disease? Celiac disease, problems with wheat, rye, barley, oats. Anything without wheat, rye, barley, oats would be. You don't want the French toast. Fish sticks has, and macaroni and cheese have also some sort of flour that you don't want. And there's garlic bread. You can't have that either. So banana omelet, bacon omelet, bananas, milk is all perfect. What is phimosis? Ouch. So phimosis is when uncircumcised male, the foreskin gets so tight that it can't come down and it pinches it off. What is a hydrocele? So hydro, water, seal, it's a testicle. So fluid around the testicles. Remember the whole thing, urine, surgeries, if that's what needed, protection, safety of that area post-op, as in not riding bikes and horses or whatever, and protecting it. That's one of the safety things for that one. And what's a hypospadias? Do you remember what's dorsal and what's ventral, right? Hypospadias is a ventral. It's like a vent that you open up. The door, you go outside to the top. So I remember it. And again, big thing with this is you cannot circumcise. What do you think that might be a problem for whom? How about the Jewish face and the brisk? They don't want to do it. It's part of their religion. They can't because they need it in order to do the plastic closure. So it might become a problem. Just to keep that right there for a second. What's cryptorchidism? I just love the picture. So, cryptorchidism is the failure of the testicles, one or both, doesn't matter. They don't come down into where they should be. It's one of the first things the doctors looks for. Looks for hips and looks for testicles. You suspect an infant has a cryptorchidism. How would you examine this infant? So turn them over and shake them when they come down, right? So put them in a warm room, and that warm will help them come down. Again, cold hands too. It does, and they will shrink up, and you don't feel them. So nice warm room is what you need. Multi. How is hypospadias corrected? So remember, hypospadias, epispadias is where the urine does not come out the tip of the penis or the urethra. That urethra tip is either on the bottom or is on the top. So what they do is they use the foreskin so that they can fillet open this whole penis. Remember, it's general anesthesia. These kids are filleted penis, open it up, create a cavern where they make the hole that goes from the tip of the penis to the bladder, and they close it up using the foreskin. Again, we leave that stint there afterwards for 7 to 10 days. What do we do with it? Nothing. Keep it inside a diaper so you don't urinate everywhere. What is bladder exstrophy? I mentioned a lot of things where things in the side of the belly are born on the outside. All of those are done somehow during the embryonic period where they don't close. And it's at the midline because it doesn't close where it should. So, again, big deal with bladder exstrophy, maintaining skin integrity and preventing infections. Anything born on the outside, both those. What is the priority nursing care for an infant with bladder exstrophy? Remember, the bladder still works. It still comes out the normal place, but it's just the bladder sitting up there outside of the body. And our big thing is to maintain tissue integrity. I mean, babies are incontinent, per se. They don't hold their urine, so that wouldn't be the answer. But again, maintaining skin integrity, preventing infection. What are the clinical manifestations of nephrotic syndrome? Remember, nephrotic syndrome has nothing to do with kidney failure. The kidneys are working. But what's happening? It's saying, bladder, yuck, I don't like you. So, protein is another word for albumin. Albumin is in your blood. So, you don't have that's got rid of too. So, hypoalbuminemia, of course, low serum albumin, it's the same name for it, right? And we would be swelling, generalized edema. Children with nephrotic syndrome are often given what medications for fluid overload? So we've got all this peripheral edema, all this generalized swelling everywhere, right? And it's because the intravascular doesn't have enough albumin in it, enough protein. So it spews everything interstitially. So what they do, and this is a huge concept, they'll give some sort of albumin, 5%, 25%, get that protein, that albumin back into the blood vessels, right? Then about 30 minutes later, they'll give Lasix, furosemide, and that will suck out the fluid, and it's a quick diuresis. And we use that in that acute stage of nephrotic syndrome. What is used to treat nephrotic syndrome in children? So they come in, they have, this going on. What do we give? Not to treat the symptoms, but to treat the disease. And basically, we give steroids. It's basically, we try to get that immune system from being so inflamed. And the kidneys, right? A child is admitted with acute glomerulonephritis. What recent illness could validate this finding? Remember, it's just like rheumatic fever, isn't it? So acute glomerulonephritis, rheumatic fever, it's caused by a strep infection, not treated completely or not at all. So again, how do we treat it? We're going to give the antibiotic and treat the strep infection. What is the priority nursing care of a child with nephrotic syndrome? What is nephrotic syndrome all about? The kidneys are working. It's all about intake, output, daily weights. It's all about fluid balance. That is your priority. Whether it's fluid restriction, whether it's salt restriction, and we monitor it. Are we keeping that weight the same? We know we're not gaining weight. Why is erythropoietin used in chronic kidney failure? So erythropoietin, we know that kidneys are not producing erythropoietin, which is not going to produce red blood cells. So let's let the body try for itself. Let's give it some erythropoietin and see if it works. And that's going to decrease the amount of blood transfusions they need. Multi. Children with chronic kidney disease have renal osteodystrophy. What can this do to the child? What is renal osteodystrophy? What's that all about? Osteo bone dystrophy. What's that? We know chronic kidney disease has all sorts of electrolyte imbalances and all sorts of issues that go on. But with it, remember the calcium levels, et cetera, right? So calcium levels aren't normal because of this chronic kidney disease. You're going to have problems with bones and abnormalities. You're going to have short bones, long bones, growth retardation, and then it messes with the calcium. So high parathyroid levels. Remember, parathyroid always has to do with calcium. Calcium goes hand in hand with osteodystrophy, bone problems. A diagnostic finding of acute glomerulonephritis may be. So we've hit this in all different ways. We've had rheumatic fever, acute glomerulonephritis, and yeah, they had a sore throat. Well, what's that lab value we can do instead? And it's right in the name. It's so easy. ASO level, positive anti-streptolysin. Sometimes they'll come at you with, this is the answer, not strep. So that's why I hit you with both sides of it. Which complication of peritoneal dialysis is most important to monitor, to look out, to watch out for, to be careful? Most important. Remember, peritoneal dialysis usually is on your infants, young kids, and they cannot do hemodialysis. So once we infect that belly, we're in trouble. So abdominal peritonitis can be a death threat on these children if we don't monitor, get it quick enough, because there's no other way to filter, no other way. What clinical assessment is most important to report with a child diagnosed with an acute kidney trauma? You know, I've seen this where kids are out playing hide and seek or tag or whatever the name of it is now. And they're out in the backyard. And this one kid was rounding a corner, sort of to his side, and hit a trailer hitch. And his left upper back, he had this bruise on his entire back. So of course, I put him a high acuity because kidneys and it's there and concern. He ended up with a potassium of 7.4. He had a fractured kidney, so he was admitted. It just required rest and to monitor him. But think kidney, always think potassium. Think blood pressure, think potassium, think kidney. What would you do if the fluid draining from peritoneal dialysis has changed color and now it's cloudy? What's the big deal, huh? So if the fluid color is changed, possibility of something is going on, better to be safe than sorry. You can't do anything. Call the doctor, get the order for the antibiotic, and start it as soon as possible. Multi. What should the nurse anticipate for a child who just had a renal biopsy? So we stuck a needle inside the kidney to look for urine or a piece of tissue or whatever. Nursing care afterwards. So we've touched the kidney with a needle. I'm going to watch and take it out, but I'm going to look for the dressing for urine or for blood. And because of the chances of bleeding and urine coming out, bed rest 24 hours, maybe even a sandbag there if we needed to. So 24 hours bed. And last question. What would the nurse provide to an infant that cannot eat normally? So if a baby can't eat, what do you need to do for them to encourage proper growth development? You're going to give them a pacifier. Because remember, that's how they comfort themselves. That's how they explore the world. And through that pacifier, you know, it's called a soother, right? It does keep them calm and it's part of normal growth and development. So a tracheoesophageal fistula who can't eat, give them a pacifier. They'll be happy. Nelson, good job, Nelson. Whoop, whoop, woo. Number two, CB. Good job, CB. Number one, measles. Okay.
Finally won.
Gabby and a Jazz. Good job, guys. All right. Remember, you've got your projects due this week. I need to know what you want to do. So please send me something so I don't have five of one thing. All right. Let me know. Somebody in the class already has it done. So good luck for you. And one of them is really close too. So good job with that. If you want to see me for the exam, send me a message. I'm available Tuesday, Wednesday, Thursday afternoons. I don't have any meetings then. So let me know. I'll meet with you, go over it. And anybody who wants to get ahead, studying for this exam 3 before it's here to get ready for the HESI so you don't have any stress there, so you have a cushion, let me know. I'll help you. Thanks, guys. Have a good day.